to a new study by the CDC.
Yeah, the findings show that it is the most common drug in overdose deaths, and it's a huge problem here in the upstate. 7 News reporter Kirsten Glavin is here at 7 on Main tonight to explain how this is impacting people here in the upstate. Kirsten.
Well, fentanyl is known to be extremely dangerous. Even a small speck can kill someone. Police in Greenville say they see it used all the time and that overdoses come in waves when a new shipment of the drug enters the city.
Not knowing what this is just like playing Russian roulette.
They look like your average pills.
This could be pure fentanyl, it could be a heroin fentanyl mix, you just don't know.
It really does. Down in their evidence room, Greenville Police say more of the drugs are now mixed with fentanyl than not.
And that's the danger with these.
Sergeant Tim Conroy says most users he's seen know the risks can be deadly, and they're preparing for an overdose.
It's not unlikely to go to an overdose death and to see Narcan in the house with an opiate death overdose.
He says many times even their own Narcan doesn't work.
They're hoping one of their buddies will bring them back, but unfortunately it's just not that easy to do.
According to a new study done by the Centers for Disease Control and Prevention, or CDC, fentanyl is now the deadliest drug in the country. Findings show a massive spike in deaths beginning in 2013. By 2016, the drug accounted for more than a quarter of overdose deaths in the country, killing more than 18,000 people.
Not at all surprised. Overdose deaths have been increasing, and fentanyl is certainly a part of that.
Curtis Reese works with drug prevention at the Phoenix Center in Greenville. He says people many times are unaware that their drugs are mixed.
People who are abusing drugs just don't know what they're getting.
As the opioid epidemic rages on, the number of overdoses from all drugs seems to increase. Police say since 2016, reported overdoses in Greenville have gone up by 26%. But the number of deaths is actually down from last year. Police say that's because officers are well trained with Narcan.
We're seeing now that it's taking 3 to 4 injections to take effect because the fentanyl is so potent.
The CDC also pointed out in their report that from 2013 to 2016, there was a 113% increase in overdoses from year to year caused by fentanyl.
So disturbing, so many human tragedies in the midst of all of this. So let's talk about the danger not just to the user, because obviously that's apparent. What about to the casual person, the law enforcement people, kids in a home?
Absolutely. So what you saw there, those little pills, those can easily get in the hands of children. And we were told that that has happened in the past. The officer we talked to there said that actually one child got a hold of what he thought was a sweet tart, and it ended up being laced with that. So obviously a huge danger there, but also for officers that are handling this, they have to wear gloves and things like that. And canines as well. Canine handlers have Narcan available for their dogs in case they get a whiff of this. So yes, everybody is all hands on deck when it comes to this. It's so dangerous.
Kirsten, thank you.
Drivers died after a crash in Greenville. Happened just after